Okay, so if you're new with me, you might not realize that Barack Obama is in love with me. He hasn't quite realized it yet either, but he is. Okay, so then, I am not disoriented. He loves me. He does. Alternate reality. No, he loves me. Yes, exactly. The delusions are in the thought in my head, the thoughts in my head. So then delusions are inside my head, hallucinations are on the outside. Okay. So then, yeah, he loves me. I don't know what you're talking about. When it comes to delusions, there are a couple of types. The one that I'm suffering from is called erotomania. Ops are after me, watching me. So that's an idea of reference, and that's probably that paranoia one. But yes, that is delusion. That is totally delusion.
So delusion are thoughts that's inside of your head.
Inside of your head. So one of the things, if you're treating a client, you'll ask him if he says that he's doing things or hearing things, you're going to ask him, are those inside of your head or outside of your head? Hallucinations affect my 5 senses. So I am seeing my mouth. I'll come back to those. Let me go back, say what's delusions, okay? I'll come back to those. So delusions, there are 5 types. Okay, the ones that we most often have: erotomania, when you believe someone famous is in love with you. Again, I am pretty sure he's in love with me. He just doesn't know it yet. And then I have grandiose. So I think I'm amazing. I think I'm the king of England. All these thoughts in my head. I'm going to go up and rob a bank because the voice in my head told me that I am the bank owner. It's me. Jealous ones, of course. Persecutory, those are the ones most often with the police, the paranoid. I think someone's after me. Those are the ones that are persecutory. Somatic, that's a body illness, and then mixed. Okay, sometimes you'll also see ideals of reference. Those are also types of delusion. An ideal of reference is a little bit of that is true, and then you take it way out. So, for example, when Barack Obama is on TV and he's giving like a speech to the nation, when he winks his eye twice, that's his code to me telling me that he loves me. That's true, really. So no, that's my idea of reference. So something really did happen. There is some truth in that, but I take that truth and then make it way out there. Thoughts in my head. Erotomania, you'll see it often, many times, someone who's they're so sure the star is in love with him. Grandiosity, jealous, persecutory, all of those are delusions that are part of schizophrenia. Okay? Inside my head, thoughts. Now, the other one, like you just mentioned, those are my hallucinations. Okay? Outside my head. My hallucinations affect all 5 of my senses. Okay? So then, visual, olfactory, those are the ones that involve my sense of smell. People will, can't you smell that my house is on fire? Can't you smell the dead flesh rotting? Can't you smell it? And we've done all of these things to look and make sure there's really nothing going on, but they swear they smell it. Gustatory hallucinations, what are those? Yeah, those are the things that you can taste. I can swear they're poisoning me. Can't you taste it? There's rat poison in my food. He put bleach in my water. Can't you taste it? Auditory, the most common. We hear things. Again, so between delusions and hallucinations, what I know is that my auditory hallucinations are things that I hear. So they're not inside my head, they're becoming outside of my head. And tactile hallucinations, those are the ones where people feel that bugs and things are crawling on them. So hallucinations as well as delusions all make up that category of schizophrenia. Okay? So in order to be diagnosed with schizophrenia, what do I have to have? Has to last at least 6 months. Okay? And the DSM is not, the test is not going to be they're not looking for you to know all of this. They're going to need the time frame. It has to be at least 6 months. Okay? 2 or more of each of the following during a 1-year time period. Okay? So delusions, hallucinations, disorganized speech, the negative symptoms. Let me come back to that one. Okay, so those are the things I'm looking for. Okay, delusions, again, hallucinations. The most common thing is that disorganization. We don't really have to worry about our schizophrenics being dangerous because they really can't get it together enough to be dangerous. They lose everything. And many times you'll see, the homeless people with their shopping cart because everything they own, because everything else they can't get it together. They can't remember to, put the lid on the whatever they're using. It's so hard for them to focus on anything. Okay, so in general, we do have positive and negative. Has anybody seen that? The positive and negative signs of schizophrenia? My positives are things that I don't have that I should have. Things that I have that I shouldn't have. Things that are added. Okay, so delusions, hallucinations, disorganized things are things I should not have. So those are the positive signs, things that are added to me. That's positive. My negative things are things that I don't have that I should. I'm missing. So positive things are the extra things that you're giving that I have. You're adding on to me. Negative are things that I wish I didn't have. I'm missing. So then flattened affect, that's your mood, your face, your mood, that's what's going on there, your flat affect. Reduced speech and lack of initiative. So many times I'm just kind of sitting there and just not having those things. Okay, positive things are things that I should not have. Negative things are things that I should have. So you might see that in your studies of looking at the negative and the positive signs of schizophrenia. So do I start off with schizophrenia?
No.
What do I say? What I have the first 1 day to 1 month? One day to 1 month is that is a brief something. Okay, brief. Okay, it's got a brief psychotic episode, brief psychotic disorder, brief. 1 day to 1 month. Okay. So then after 1 month, I still have those hallucinations. It becomes what? Schizophrenia form, a form of schizophrenia. Okay. So the symptoms are the same as full-blown schizophrenia. It's the matter. So it's a brief psychotic episode, 3 days to 1 month. 1 month to 3 months gives me 1 month to 6 months gives me my schizophrenic form, a form of schizophrenia. Okay. And then my last one is full-blown schizophrenia. So I have to have those symptoms for at least 6 months. So again, 3 days to 1 month, and then 1 month to 3 months, and then 1 month to 6 months, goodness, and then 6 months on. Okay, so that's what I'm looking for. So then, how do I treat this disease? We'll give you some good old antipsychotics, right? Well, yes, Pam, I think you should. So, my list of antipsychotics. So I get to name you a couple. Okay, so my list of antipsychotics, I'm going to look for most often like a risperidone, side effects there. I'm going to look for a thorazine, a risperidone, a haldol, any of those. My list there. There we go. So it's risperidone, but again, you'll see Risperdal on the test. It might look exactly that way. Seroquel, Zyprexa, Clozaril. Those are the ones we most often see. Abilify is one of my new ones. but those are the ones you'll likely see. So risperidol or risperidone, and then Seroquel, Zyprexa. Those are the most common ones you're going to see. Clozaril you might see. Does anybody know what the problem with Clozaril? Why you can't? What the problem with that one is? Okay. It's used to treat antipsychotics, but many times this is the word you're going to look for. It's a granulocytosis, a granulocytosis. So if you see that word, you're going to know that's Clozaril. That is that means like that has to do with your white blood count. Your white blood count is off. Okay, but that word right there, I try to teach you. You'll never know everything. I cannot teach you everything ever, but I try to teach you enough so you know kind of when I see that word what that means. Okay, that's a side effect of Clozaril. Has anybody seen that in any of their study questions?
No, not yet.
Okay, so you'll see that on a couple of questions. So that is a side effect just of Clozaril. It's an antipsychotic. That one medication has that side effect. Okay, so when you see that word. Okay, the major side effect for my people who are on schizophrenic medication is that tardive dyskinesia. Tardive dyskinesia is that very strange movement they make with their mouth, and it is a side effect of the medication. It stops when the medication stops. There. So can you imagine you're already a little schizophrenic, a little cray there, and then suddenly, now you can't even get in. You can't even, you can't hold your face together. It is a central nervous system disorder, not a physical disorder, not a muscle disorder. Okay. So schizophrenia and the medications, tardive, that's correct. Tardive dyskinesia, that's it. Put it up there so you can see it. Tardive dyskinesia, that's the term. But it's a central nervous system disorder. I've seen that question. Is it a muscle? Because your mouth is moving, so you think maybe it's something with the muscles, but it's not. It's central nervous system. It's a brain disorder because of the medication. Okay. So it belongs to it's an antipsychotic. Almost all of my antipsychotics will have this, and that is the mouth moving. It is once you stop the medication, it will just go away. It's no big deal. The medication to treat that, though, is Cogentin. And Cogentin is then a medication that treats the side effects of the schizophrenia. It's used for like Parkinson's disease, but it's mostly used for the side effect to stop that mouth movement. Okay, tardive dyskinesia when it comes to those medications. Okay. Okay, so talked about schizophreniform. We've talked about the first one, which is a brief psychotic disorder, and then we have our schizophreniform, schizophrenia. Okay. We also have schizoaffective disorder. You might see that. Schizoaffective disorder is the same criteria for schizophrenia, at least 6 months of those symptoms. What's the difference with schizoaffective disorder? An affective disorder. Go ahead. Somebody gonna say something? So an affective disorder is always a mood disorder. AFFECT means mood. Okay, so whenever I see that, I know that's exactly what that means. So a schizoaffective disorder, I get all of those lovely symptoms of bipolar, the ups and the downs, on top of having my lovely schizophrenia symptoms. Okay. Has anybody seen schizoaffective disorder and diagnosed in the real world? Okay. So this is just an opinion, There's no factual research on that. So most often in the real world, what you'll see a bipolar disorder, the ups and the downs with psychotic features. Okay, so you'll see ups and downs, so I know if I haven't slept in 5 days or if I've been in bed for 10 days with that depression, on both ends, I can have some psychosis, some delusions. That's possible just because of what's going on. So that's most often what you'll see in the real world. However, if you work in the prison system, we have an overabundance of people who are diagnosed with schizoaffective disorder. Why would we do that, do you think? Exactly. So if you were being treated with a heavy-duty antipsychotic as well as a bipolar disorder, don't you think you're probably pretty lethargic and knocked out? So those diagnoses require both those medications. Okay, so many times, and again, personal opinion, what I find is many times people are overdiagnosed, so they can be over-medicated while they're in prison. So if I've got a big old guy and he's got this diagnosis and, I can treat him with these both medications, he's working around like a zombie. So schizoaffective disorder, and if you've seen it in the real world, please, text me later, talk to me. You just don't see it a lot in the real world. You'll see it in institutions, again, but I'm not sure that's the correct diagnosis. I think it has more to do with being able to sedate people. So that's my opinion, whatever it's worth. So then, that's why schizoaffective disorder is the same thing. It's got the mood disorders, it's got the ups and downs, as well as the schizoaffective stuff going on. Okay, those are some biggies. We talked about bipolar, we talked about depression, we talked about schizophrenia. Schizophrenia, it is diagnosed between usually the ages of 15 and 25. What most often happens is cute little Barbara Ann is just living her little life, and her mother sends her to college, and she has a major psychotic episode like in the courtyard of a freshman year. So we're not really sure what the cause is. We do believe there are some underlying issues of mental illness in the family, but the stressors that happen in those early 20s or late teens many times will cause you to go in a full-blown psychotic episode. Between the ages of 15, it's usually 15 and 30 sometimes on the test, 15 and 25. That's the most common diagnosed time. We do have childhood schizophrenia. Okay, so we don't think so, and I'm not going to pretend like I'm a scholar, but the research I've said is we don't really, maybe, how about that? Maybe something triggers it, but everybody goes to college and everybody doesn't have schizophrenia, right? So what we believe is there's some genetic piece or something going on that for this combination of people, that when the stress happens, the stressor happens, in addition to that change in your life between those times, that's when we see it, but we do not know the real cause of it. So I really don't know. We do, but we're looking back, we do know that we're looking for a history of mental illness in the family, maybe not schizophrenia, some other kind of things going on, but we don't know. So again, little Barbara goes to school and she starts seeing the rainbows chasing her, and she has to come home. We also do know that if you're over the age of 40 and you have your first psychotic episode, then you're more likely to recover. Okay, again, both of those are test questions, so that's something you might want to look for when it comes to schizophrenia. Overall, in the real world, they're not as dangerous as we see them portrayed on TV, just not as so. Okay, so then those are some of my biggies. We'll do some testing, but I'm going to go over one more thing before we go. Let's talk about my personality disorders. So again, if you're as old as I am, what we know is those used to be on the Access 2. We took them off because we no longer have any other access. We don't have the 5 axis anymore. What do you know about personality disorders, guys?
Like borderline disorder.
When are they diagnosed?
Shoot, I'm not sure.
Well, thank you. Good answer, though. You're right. Borderline is one of them. Thank you. Okay. So what we know, though, is they're not diagnosed until you're 18. You have to be legally an adult to be diagnosed. However, We know that people have had these behaviors their whole life. That's what makes them personality disorders. They're ingrained in who they are. So they don't come for treatment, okay? That makes them ego-syntonic or ego-dystonic. Personality disorders are ego-syntonic. They are in that people don't have a problem with them. I've been this way my whole life. I don't know what you're talking about. Why would I come for treatment? Ego-syntonic, in sync with who I am. Okay, so it's who I am is in sync. So that means I'm not coming for treatment because that's who I am. Okay, if we're going to go through the disorders, but when we look at a conduct disorder, so conduct disorder is diagnosed before the age of 13. Those are my little kids who are killing animals, have no remorse, all those things, poking the eyes out of the dog. When they turn 18 untreated, they are my antisocial personality disorders. And if you're not really sure, antisocial does not mean they don't like people. Antisocials love people. They will invite you to their house. They will cook for you. They will kill you, and then they will eat you and blame you. So we know our Jeffrey Dahmers, our Ted Bundys, those are my antisocials. The term that we use in the lay term that you'll hear on the news or people say is sociopaths. In the field, we wouldn't use that word. It's called antisocial personality disorder, and we do know it's traced from childhood, but we didn't diagnose them yet. Okay, so ego-syntonic is in sync with who they are, not coming for treatment, have no problems with it. The only other diagnosis is this ego-syntonic is my eating disorders. Anybody know which one that is?
Anorexia.
Yes! Anorexia. Anorexics always think that they're fat, no matter what. They can weigh 3 pounds. And someone's going to say, honey, you need to go get treatment. Bulimia is not. My bulimics are actually normal size. We don't see them to be very thin. It's only my anorexics. And bulimias are not. They're okay with coming for treatment. So it's just my anorexia. Now, you can have an anorexia bulimia diagnosis and be diagnosed with both. Okay, but my bulimics are people who are eating, stuffing food in and throwing it back up. You wouldn't know by looking at them. So bulimic is ego-dystonic. Yes, it is. I don't like dys. Got it. It is ego-dystonic. The only one that's ego-syntonic is anorexia. Okay, they're the ones that have to put in the hospital to get them to eat because they're so thin. And no matter what you tell them, they're still so thin. Okay, bulimias, you wouldn't know by looking at them. So then, a good example, good response, by the way. So OCD versus OCPD. OCD is my obsessive compulsive disorder. That's my blue. My green is my OCD. OCPD, that's my personality disorder. Okay? Again, personality disorders have been this way when they were a child. If I asked their mother, they would say, when Johnny was 4, he had to pour his cereal in 4 little things. He would only do it in 7s. Johnny came back and he had to check the bedroom door like 7 times his whole life. Okay? And I'm pretty sure I'm talking to some people in this crowd. So if you want to chime in, you can. My OCD people, it's a psychopathology, not a personality. It is it's one of used to be our axis 1, but it's a main diagnosis. So in the blue, you'll see signs and severity. Signs and symptoms vary in severity over time. So what happens is OCD, especially with this COVID thing going on, my OCD people are freaking out. Anxiety goes up, right? So more things I can't control, the things I want to control. So then my hands are filthy. Oh my gosh, and you see the COVID on my hands. Of course, not in the South because we don't have it, but up there in the other states, the COVID on my hand, have to wash. Obsessions are my thoughts over and over and over again, my thoughts. Compulsions are the actual behaviors. Over and over again, I have to wash my hands. But the stress causes anxiety to go up in my blue people. My green people, nope. They're still doing their same routine. Has nothing to do with anything else, but that's just who they are. Blue people, easily recognized because of the severity of it and the change. So, suddenly you see, your dad, he can't leave the house because he's going back every 5 minutes to check like the doorknobs. Okay. Or the personality disorder that you slightly recognize because they've always been that way. Yeah, Bobby's a little strange. He only does this in sevens. Or Bobby won't step on a crack. Or, Bobby only answers the phone on the third call. But he's been that way since he was a kid, so it's not always diagnosed. The biggest issue is the motivation. If you see on a test that little Johnny, Mary Sue, Mary Ann, Karen wants to be perfect, that's a personality disorder. My personality disorders, that's my green, they will turn their work in late because it needs to be perfect. Okay? Do you remember the kid, or if it was you back in the day, and you'd ball your paper up and start all over because you made a mistake? That's my personality disorder. Okay. The other one, my blue, that's the disorder. That's why they seek help, because they are so sure something awful will happen if they don't follow through. Okay. So if I don't wash my hands, if you've had me before, I had a client who had to bleach her house every night. She had a 6-month-old baby who was crawling, and she had to bleach her house every night. She'd be up for hours bleaching. And I kept saying, so what happens if you don't bleach? Oh my gosh, you don't understand that my baby will get sick. Okay, babies get sick. What'll happen next? Oh no, my husband will blame me and he'll leave me, and then I'll lose my job and I'll do this, and all these things will happen because she didn't bleach her house that one night, or she's missed a spot. So that her disorder, that's why that makes it ego dystonic. She doesn't like that. Nobody likes that. My green people, they have motivation to be perfect. Okay, but it's not as if something awful is gonna happen. I'll just turn in late, and I don't understand why they're mad at me because I had to get it done right. Okay. Again, the blue, okay, they accept their condition and they'll come for help. The green people, ego syntonic, they're not coming for help. What's the problem? Okay. And then the blue and green, the blue people again, they want their life to be back to normal. They realize this is not okay. My green people do not. Their family and friends may send them, but they're not coming. That's ego syntonic, ego dystonic, difference between obsessive compulsive disorder and the obsessive compulsive personality disorder. Okay. And I do realize I talk fast. However, go back and watch the video. I try to get as much as I can get in this hour and a half. So feel free to ask me questions, but you can always just go back. Okay. I can definitely share that. I'll put that in the chat box. There it is. If you're not sure where your chat box is, that's where the video will be after this one. So it says open and close conversation on your screen. If you open it, you will see anything that I post. And remind me, again, anything I share, I will gladly share with you. No problem at all. But it's going to be right there in that chat box. So go back and look at it. And that's where the videotape will be. Okay. So then back to my personality disorders. We'll give you a couple more of them. My paranoid. Okay. You know those people. Again, it's not a delusion. It is not a hallucination. It is an ingrained people. My brother, I hope he never watches my videos. He's got paranoid personality disorder. He is so sure that everyone is out to get him. He's been that way his whole life. He's not hallucinating. He is just so sure that people are out to get him. So he thinks that when he goes to Walmart, that every person coughs on him and purposely. Now, I do realize there are bad people in the world, and it does happen. I'm not stupid. It does happen. But I'm pretty sure everybody doesn't just cough on him because they're trying to get him. Okay? Schizoids and schizotypal, they're the ones who love COVID. Absolutely love COVID. So schizoids, they are, oops, my schizoid. My schizoids are staying to themselves, okay? I think that for a lot of people, that's what you thought antisocials were the schizoids. My antisocials are not schizoids. My antisocials will kill you. They're not antisocial. They're anti-people. They're anti-rules. They will kill you, eat you, and blame you. No remorse. Schizoids just don't like people. COVID is the best thing that ever happened. No one ever knocks on their door anymore. They're not expected to talk to people. They are so happy. Those are my schizoids. Schizotypals typically like a schizophrenic. Okay, so again, not having the hallucinations, not having the delusions, that we don't have enough diagnosis for that, but in their personality. You've asked back and their mother says, you know what, Johnny was always a little weird. Johnny always liked to, he put like strange things in his pocket. Okay, interpersonal awkwardness, social isolation, superstition, eccentric speech, eccentric appearance, and odd speech. So I have a client who will always wear, even in this, I'm from South Florida, so even in the summer, he would wear like the winter hat with the earmuffs on it because it kept people from reading his thoughts. Okay. They might have some foil on their windows, some things. So they are just typically like a schizophrenic, but not a psychotic episode, nothing like that, just a lot weird. So schizoids, schizotypal. The difference is schizoids are not going to come near you. Schizotypal, they're obviously weird. You'll see them, their appearance. They'll try to talk to you. Weird. Okay. So those are my cluster 1. We used to call them cluster 1, A, B, and C. I haven't seen them labeled on the test that way anymore. It's just a kind of good way to remember. My first ones, they're just avoidance, rigidity, that one. My second one is my antisocials. Again, we just discussed those. Kill you, eat you, blame you. Okay. Borderlines. What are they like, somebody? Exactly. Come on, somebody have borderlines. You all know one.
They're very black and white.
Very black and white. Love you, love you, love you. Hate you, hate you, hate you. Again, ingrained in who they are.
Are they always on the edge too?
Not always. Not always on the edge, because when they're loving you, you're great. So if you've got a client or on the test, they have seen 12 different therapists before you, but you are the best. Oh my God, I finally met you and you've saved my life. You're amazing. Oh my gosh, I love you. I've seen 12 other ones and none of them were as good as you. And you've known them like 15 minutes. But then next week, if you show up 15 minutes late, or, if you wear the wrong color dress, they hate you. Okay. Very black, very white. They'll just stop coming. So the goal of borderline personality, or all of my ego syntonic behaviors, there's not a problem, is to make them ego dystonic. I don't like dys, or ego alien. Both of those terms mean the same thing. That's the treatment, to make it ego alien, which is the same as ego dystonic. Look for the word. But foreign to their ego, that's what I'm looking for. So it's ego alien. Ego dystonic is the same as ego alien, foreign to my ego. Okay. There was also that little kind of therapy that came up with just for bipolar disorder. Somebody know what that one was? Something about DBT. Yeah, yes. That was. Oh, sorry, I have dogs, guys. I have kids who have dogs. Okay, DBT was actually one of the people who kind of authored it really was to work with those those borderline people. Okay, the goal of my DBT really is to teach them to stabilize their moods. So things like mindfulness, distress tolerance, emotional regulation, all of those things that are used for people who have borderline. Okay. So again, they're always on the border, not necessarily on the edge, but the border. They hate you, hate you, hate you, love you, love you, love you. Nothing in between. Okay. A history of unstable relationships. Many times Freud would say it had to do with, the way they grew up, their parents and stuff, but in general, they don't have consistent relationships with anyone. So that's why they have so many therapists. They have so many friends, or had friends, because they're intolerant of any mood that's uncomfortable. So if you have them in therapy and you're treating them and you're, getting someplace, and all of a sudden you touch a nerve that's uncomfortable, they're going to leave. So that's what we try to teach them. mindfulness, emotional regulation. It's very common with children. Anybody work with children and your program uses DBT?
Yeah.
Yeah, that's what it's very common with that. So there are no medications to treat personality disorders. Okay. So that just understand that if it talks about medications, we can treat some symptoms, but personality disorders are ingrained in who you are. The treatment is to change that from the behaviors from ego syntonic to ego dystonic. Like a antisocial, they really have no feelings. They don't understand they've hurt somebody else. So the goal is to teach them empathy. Okay, so we're trying to teach people how to make that current behavior to realize it's not okay. Okay, so DBT is what I'm going to use for that. Let's go back and just pick up a couple of personality disorders. Okay, my histrionics, those are my girls. Okay, for the test, the histrionics are going to be girls, narcissists are going to be men. Is that way in the real world? It is not. And for the test, my histrionics are my drama queens. I'll tell you, if you're not the drama queen, if you don't know the drama queen in your group, it is probably you girls. Okay. Oh my gosh, attention, look at me, look at me, look at me. I can't believe it, I can't believe it. My high heels, my little short skirt, bright colors, look at my hair. Oh, I got my eyelashes on and I'm just going to McDonald's. Okay. So if it's look around your girlfriend group, if you don't know one, just look in the mirror, might be you. That's my histrionic. For the test, they're women. Drama queens, they want attention. You might see a test question that says, Pam is very upset because your new boss didn't even accept her Facebook request. Oh my gosh. Like, how can he not? Okay. So they are just about the attention and the drama. On the other hand, my narcissists, those are my men. My narcissists, again, it's always about them as well, but they're not that dramatic. My narcissist would walk into a party and, sit down and, if you came close to talk to him, he would talk about, wow, he would think, how lucky you are to be with me. Because I am the greatest thing on this earth. Okay. Narcissists also have issues with not having to have any remorse or any thought patterns of how anybody else feels. For the test, again, they're going to be men for the test, not always in the real world, but for the men. My narcissists also do not have, they're the ones, the question might say which one has the low self-esteem, which personality disorder, and you might think all of them, but for the test, it's my narcissists. What they're doing is they're projecting to the world. That's a test question. Projecting their insecurities. Okay, so I'm going to put you down to make me feel better because I have low self-esteem. They're self-centered, a sense of entitlement or superiority. They're always right. Girls, if you're dating a man that's never said sorry, just saying, okay? I don't think I have any guys today. Okay. But yeah, so those are my always right, always right. You are lucky to be in my presence. Lack of empathy. You're feeling what? You hurt my feelings. I did not. You need to keep your feelings in check. Okay. No empathy whatsoever. Manipulative and controlling. Okay. Strong need for admiration. They're not going to be, okay, so this is upset if the spotlight is not on them, but they're not like my drama queens who walk into the room and like, shh. They're not like that. But they would be surprised if you didn't walk up and talk to them. Like, oh, who am I? Easily wounded. That's because that self-esteem is so low. Okay. So that is my narcissist and we got those antisocial, the ones that will eat you and kill you. Borderlines, black and white. Splitting is a term you'll see. That's a defense mechanism, but they split, all good or all bad. Histrionics are my drama queens. Me. My narcissists, it's all about them, but they have no issues. They have low self-esteem. Okay. Avoidants are the ones who like you. They're not the schizoids. Schizoids are afraid or don't like you. Avoidants like you. However, they're not going to come around you because they're afraid you'll judge them. They don't like being judged. They're fear of being judged. My dependents, those are the ones who's, they're 35 years old and still live with mom or dad. They don't trust their own judgment. That's the problem. They don't trust their own judgment. So I think something must be going on there. And then my obsessive compulsive, we talked about those, my OCD people. Okay, one of those pretty quickly. I want to pull up some questions. Anybody have anything you want to ask me? Let's go back and see what it looks like in a question.
So antisocial is when somebody they like you and they don't like you.
Antisocials love you. They want to kill you and eat you. Think sociopath. Okay, so they do like you because they want to kill you and eat you. Close out some windows. That's the term we used to use for sociopath. And in the lay term, you might hear someone say that. So it has nothing to do with them not liking you. They're not antisocial. They're anti the norms. They don't have feelings. So a conduct disorder untreated will most often end up as a sociopath. And my conduct disorder and my opposition defiant kids, those are the ones that are diagnosed by 13. My ODD kids are, again, they are, let me use Hellwig today. My ODD kids, they are opposition defiant. They don't have that mean streak. Okay, so my ODD kids are just defiant, but they're not mean. My conduct disorder kids are mean. Okay, so. I'm going to use Hellwig today. If you've used this, Hellwig is the first person, also the author of Pocket Prep. So you might have seen some of his questions already. I try to always use different sources. The problem is you don't want to get used to one source, because if you get used to just reading one person's questions, then you're surprised when somebody else answers a different way or the questions are different, and you don't want that. You really want to understand what's going on there. Let's see here. I'm going to use something else. Let's just go. Any questions while I pull this up, guys? Okay, just give me 1 second. I'll pull up a different study guide. I like this one.
I think one of my problems is when I do the little practice quizzes. Test is in October, so when I do the practice quizzes, I don't want to do it too much to the point where I'm going to be memorizing that stuff, you know?
Exactly. And I do not want you to. I really, really want you to learn it. Okay. So instead of doing practice quizzes, you really should be really looking at kind of studying, knowing what it looks like.
Okay.
So look at number 4, and these are social work questions. So I've just put in counselor in there, but I want you to kind of look at these questions so they're still the same DSM. Okay, so a counselor, look at that one as opposed to a social worker. So a counselor is working with a client who complains constantly of smells that aggravate him. Recently said he cannot sleep because of the fungus smells in his home. His work has been affected because the fungus smell at his office makes it impossible for him to do his job. He has had his home inspected and no fungus has been found. His employers refuse to have the workplace fumigated, and he can no longer date his girlfriend because she smells of fungus. What is he experiencing? You got it. Olfactory hallucinations. He's smelling stuff that ain't really there. Ain't nobody else smelling it. You got it. And the key is to go back in that question. Oh, look, nobody else smells it. We've done all of these things to rule it out. So he's having olfactory issues. Got it, got it, got it.
Is there such thing as hyper olfactory?
There's not. There's not. Because A is not an answer. That's why. Okay. And even if it was an answer, we're still looking. I mean, we're looking at our DSM diagnosis. You're not trying to go to medical school today, right? And if you are, I'm the wrong tutor for you because I have no idea. So remember, when you're looking at the questions, you're looking for questions that are the answers. They're not going to be lay terms, like the terms that people who have never gone to school and don't have a master's in this field. There's not going to be those terms, and you're not going to look for medical terms. Okay, so hyperolfactory senses disorder might be something that a doctor would diagnose, but we wouldn't diagnose that, right? Okay. Okay, look at number 9. And what we're finding is on the new test, and if anyone's taken it recently, you're finding more of the vignettes. Before it was those yes or no questions or recall. So now you're looking at application questions where you really have to understand it and be able to apply it. I have a B, paranoid personality disorder. That would be correct. You got it. You got it. My schizophrenia, I'd be looking for a diagnosis that talked about, hearing and seeing some things that no one else here saw. At least the time frame would need to be longer. Okay. And my intermittent explosive, again, those are people who just have a huge overreaction to what's going on. And then my bipolar 1, we know I'm looking for 5 full days of a full-blown manic, at least 5 full days of full-blown manic episode. Perfect. Okay. Look at 10, a 30-year-old woman. When you're taking the test, many people will pick or not pick the word they don't know. You're always going to use some word association. The goal is that you'll know some things. You might not know it all, so kind of rule out what you know what it can't be. Okay? So if I'm looking at a dependent personality disorder. Is she depending on anybody to get things done? Nope. Generalized anxiety disorder, when I'm looking at GAD, it's a free-floating anxiety. It has to be alone for at least 6 months, and I'm not, I can't pinpoint it to anything. It's just kind of free-floating. That's what that means. It's out there, just out there. Okay? Social anxiety disorder, that is, people who are afraid to go in public, right? Have friends around. Okay? This one is A, avoidant personality disorder. Remember we talked about avoidance? They like people, but they're afraid of their criticism. They're afraid of being judged.
So
go ahead. I lost you.
Yeah, what's dependent personality disorder?
I talked about that one. That's my axis one. They're afraid they won't make their own choices. They're afraid of themselves. That's dependent.
Okay.
You'll see like the
I gotta make this up.
35-year-old man who still lives with his mother, and you ask him if he wants to go on a date, and he says, I have to check with my mother first?
Gotcha. Okay.
Okay, that's what that looks like. So my avoidance, they're going to avoid you, but they like you. They want you to like them. They're just afraid. And the key in that one was saying, you know what? She was raised in an abusive home. She thinks she's inferior to others. She is excessively sensitive to the criticism from her siblings. All those things are, that's important. So we have to know those. Okay. Okay, some Lion King in the background. Okay, so then let's go back. Nope, I'm not using that one. Sorry. The answer is A on that one. Yes. Avoidant personality disorder, because they're the personality disorders. Remember, they're egocentric. That's who they are. However, she is afraid of what you'll think of her. She misinterprets a comment from a friend. She worries about it until she makes herself sick. The anxiety in social situations is common, but the key in that one was the abusive family, and she's extremely sensitive to criticism from her siblings. Okay, that's what that means. Okay. Egocentric, exactly. All personality disorders are egocentric. There you go. Good, good, good. Wouldn't come for treatment unless, somebody made her come. Okay. 11. Look at that one. The personality disorder question. A counselor. Just a counselor. He is narcissistic. You're absolutely right. Look at all those things I've done. Oh my goodness. He focuses on himself and he wants admiration. Look at what I've done. Look at me, look at me, look at me. Okay. Remember my borderlines, black and white, love you, love you, love you, hate you, hate you, hate you. Histrionics are most often my women. Drama queens want attention, but they're very much drama queens. Okay. My histrionics, they do have empathy. They're not like the narcissists. Narcissists don't have any empathy. And in the real world, this is not the case. But for the test, narcissists are going to be men. Histrionics are going to be women. Okay. Number 12 is just an interesting question if you don't know. So the best treatment for children with ASD, the Autistic Spectrum Disorder, there is no best treatment. We treat the symptoms. Okay, so if they're hyper, we'll use it ADHD. If they have behavior problems, we'll treat it with behavior problems. But the best answer is D. There's no single treatment. We treat the symptoms. If they can't make friends, we teach them how to make social skills. Okay, there are some medications we use, but we treat the symptoms, not the ASD. It's autism spectrum disorder. Okay, we'll go down, pull up a few more of those. Okay. Okay. Look at 93. We didn't talk about those, but those are my personality disorders. Let's see if I'm sorry, my defense mechanisms. Wow. 93. So you can see that one. That is correct. Oh, yes. Compensation. He's making up for what he doesn't have. Remember, those are all Freud's terms. Those are in those the first section of the study guide when it talks about our developmental psychology, developmental theories, and that's a Freudian therapy, and all of his defense mechanisms are that. Conversion disorder. Conversion disorder is when something very painful happens, and trauma happens, and I end up. You should know them in general, just total, yes, and I'm going to do a whole session again just on defense mechanisms. You need to know them. Okay. Conversion disorder is, again, so something traumatic happens and then something physical happens. That's under the somatoform disorders. So conversion disorder is, oh my gosh, I saw my child be like killed or hurt and I can't see. I was running and I fell and I tried to save someone and now I can't walk. So something has happened, some trauma. It's converted into a physical symptom. And remember, all of those disorders, they're going to come with already been diagnosed by the doctor that there's not a medical problem. Okay. Denial is almost always used only with my drug users. You might see it someplace else. But if it's denial is the first one there, make sure that's the right one, because it's almost always with a substance abuse issue. Okay. Compensation is you're overcompensating. I think of like my Disney dads, weekend dads. They haven't seen the kid all week and they come and spend overabundant amount of money. And reaction formation is I'm creating a reaction totally different than how I actually feel. I'm creating I'm creating a feeling actually I feel. Okay, look at 94. Diagnostic again. What's the best diagnosis? So is she, do I see her throwing up? Those of you who talked about bulimia disorder, is she throwing up anywhere? My major depressive disorder, do you see 6 months? I'm sorry, do you see at least 2 weeks that she can't get out of bed? Tell me where you see it in the question. Tell me where you see it in the question. Where do you see? She's been doing this on average for twice a week for the past 6 months, but I don't see anywhere in that question that she's had depression that she can't get out of bed for at least 2 full weeks. Just overeating, exactly. So then, is overeating disorder an answer? That's not in my DSM. Binge eating is. Okay. Bulimia nervosa would say that she's throwing up. Do we see her throwing up in the question? Eating more than I should. Unable to stop. She feels uncomfortable. If it's said, then right after she ate, she went and threw it back up. That'd be binge eating. Okay. So what we're looking at in an overeating disorder is not a DSM diagnosis, and there's nothing in there to tell me that she has the major depression. So that's what makes it binge eating disorder. Okay, so these are very typical on the test. So that's why I say to you, you really kind of have to know this part, because you've got to know what it says. So when you go back to the question, it's not going to be, just a recall. You have to figure it out.
Okay.
Look at 96. Okay, a 5-year-old. What's that one? You're never going to know every disorder in the DSM. They're not trying to make it that hard for you. They're just trying to make sure that you know. So when it comes to like 96, rule out what it can't be. What can it not be?
B. Wait, hold up.
B is the answer. You're absolutely right. My reactive attachment disorder. Absolutely right. Kids who've never bonded. Okay. You got it. So reactive attachment disorder is based on Margaret Mailer's theory of object relations. Does that make sense?
Yeah.
She's again is that helping professions part. I'm sorry, the first chapter talks about the developmental theorist. But Margaret Mailer came up with my object relations theory. She's a little bit Freudian. Okay, object relations is not an object; it's a person. So what she said was, if we don't have that one person to bond with, then we're never going to have that safe base. Okay, and that's where that reaction attachment disorder comes in, because I've never had that one person to have my base, to be safe with. Okay, and if you know her theory at all, let me see. So her theory said that if we don't attach, then we will, the odds of us having some really big issues later are huge. Okay. So again, this is in chapter 1 of the first study guide. If you're breaking it down domains, it would be in that chapter. But this is Margaret Mailer. And what she said is we have that first normal autistic phase, normal symbiotic, where we get really, we don't understand, babies don't understand that they're separate from their mother, but they do know that they need that mother to eat. The individuation separation part does not happen until they are 5 months old. Okay, that's when you'll see babies begin to look around. You're feeding them and they're like, oh, they'll look around like, oh my gosh, there must be somebody else in the room. Okay, that's when they realize they're separate from mom. Hatching, practicing rapprochement, all those things are the phases. You don't have to know all those phases. You do have to know that the secure development happens between the ages of 24 and 36 months. Okay, that's when it happens. And at that point, then babies do realize they're a separate person than their mom, and they have developed that object permanence. If they've been from foster home to foster home to foster home or different caregivers, they never develop that, according to Margaret Mailer. Oops, try that one. Okay, guys, I went over a couple of them. Just some other things. Let me go back over here. So any questions in general? If you are not tutoring with me and tutoring on and studying on your own, break it up into pieces. There's way too much information to pretend like you can get this in one setting. I'm going to turn my camera off. I'm going to stop recording.